are in the room? Survivors? How many people know a survivor? How many people unfortunately had a member of their family affected by breast cancer who's no longer here? Absolutely. So today, during the entire month of October, I'm sure everybody from across the nation will be focused in on breast cancer and awareness and telling folks to get their mammograms. But for me, it's a year-long conversation. For me, it's a conversation that I am committed to having every day. I believe that my life was spared so that I may continue having the conversation. And that's exactly what I've been doing over the past couple of years. Um, from a young age, I was always told that, you strive to be whatever you want to be, and that can happen, Natalie. My mother told me, my grandmother told me, my father told me, but I didn't know that my greatest challenge and what I'd be striving most to be would be a breast cancer survivor. And so I don't take that lightly. I work every day to make sure that I remain a survivor, and that's not always easy to do. My journey with breast cancer began in a rather unusual way. My mother was coming to visit me. She lives in Richmond, Virginia, and she was coming to visit me, and she was saying to me, "You've turned 40. It's time for you to have all of your big girl tests. Get to the doctors, Natalie." And I had heard just about enough of that, right? She was coming to visit me here in Washington, D.C., and I knew that that was going to be one of the first things that she would say to me. "Did you have your mammogram?" So instead, me, I tricked her. I got to the doctors before she got there, and so when she arrived, she for sure asked me, "Have you had your mammogram?" "Absolutely I did, Mom." So we didn't have to talk about that the entire time my mom visited with me. She left, and then I got an interesting letter in the mail. And that letter said, "Your test was abnormal." So I called my mom, and she said, "Well, that's no big deal. Don't worry too much about that. Sometimes they just need you to come back and get checked out again, do another test." And so I kind of put it off for, I don't know, almost 2 weeks, even making the call. Um, the first time I called, no one actually answered the phone. In between that, I was running for city council, and so I was shaking hands and kissing babies and caring for this person and going to that community meeting, and I didn't call right away after that. So finally I said, well, let me place this call and get back down to my doctor. I go down to my doctor. By the way, George Washington Hospital took great care of me the entire time. So I go to my doctor, and we do tests. And I'm telling you, I was there the entire day. One test after another test, one biopsy after another biopsy. I know that I drove there. I really can't tell you how I got back. I mean, I did drive home, but I can't tell you the state of mind that I was in when I left there. When the doctors pulled me aside and they said, "Ms. Williams, you have breast cancer. You have breast cancer in your left breast." And it was devastating. It was devastating. No one in my entire family has had breast cancer. Not one person. In fact, when I called my mother from the hospital, I said, "Mom, you would not believe what they said. They said you have breast cancer." She says, "How'd you get that?" Right? As if, some diseases, you do something that you get it. So her response was, "How'd you get that?" And I knew nothing about breast cancer at that time. I said, I don't know. I don't know how I got it. So I had to, at the doctors, they said to me, "We know for sure, Miss Williams, that you are going to do reduce the size of your tumor in your breast, you will have to have your left breast removed. What you need to do is decide what you're going to do from that point on. And so I went home and I thought about it. I cried about it. I talked about it. I prayed about it. I cried about it. I talked about it. I prayed about it. And then I was stuck on the vanity of it all. What does one breast look like? I'm a single woman, and I'm thinking, we're having a real talk here, right? Mm-hmm. So I'm a single woman, I'm thinking, what the hell is that going to be? Right? So once I got past all of that, I said, this is not about vanity. This is about saving my life. Mm-hmm. And so I made the very tough decision at the time, but very easy too when you think about it. Not only was I going to have my left breast removed, I was going to have both breasts removed, so that I would not have to have that level of concern years down the road, right? And so I went on that journey. I had my double mastectomy. After that, I had my cancer treatments, and then my chemotherapy, and then I had my radiation. I pulled this picture out. This is a picture of me that was taken while I was doing my cancer treatments. And I almost walk with this everywhere I go. But this picture, while it's, very beautiful and at the first glimpse, I guess, it represented a very dark period for me. I wanted to capture my experience, and in the field of communications and public relations and all that, I know about photography and all of that. So I wanted to capture it, and I wanted to capture it in a way. But this picture here, I was in between, I think I had my fourth chemotherapy treatment. And I had to time it, because when you take your chemotherapy, for me at least, I was very sick after the first 4 days. And then I'd have this small window in which I could, do the things that I needed to do. Well, on this particular one, I went to do this shoot. Everyone in front of me, I had just gotten my new breasts, and everyone in front of me, the lights were flashing. They were, oh, this is so beautiful. When you look very closely at this picture, there are tears in my eyes, because I was still unsure of what I was doing. Well, as it turned out, the East of the River made this their cover story. And so now when I look at this, I see strength, I see courage, I see a time that I had to go through in order to do the things that I'm doing today. So I'm very thankful that I have this to remind me of that period. So along my journey, I kept hearing these messages about breast cancer, and the messages really, for me, did not speak to my experience, nor did it speak to the communities of color for me. Again, I reminded you that in the years past, I've been a public relations kind of guru here in DC, and so I know a little bit about messaging and making sure that you're getting your message to the right people at the right times. And so as I was going through my treatments, I thought, this information that I'm blessed to have certainly is not getting to those people who are affected the most by it. Hi there. And I started thinking, I am what I consider, in the know in DC. I'm well educated and I have health insurance. And yet I still didn't know, had it not been for my mom, right? I still would not have known the things that I was supposed to be doing as it pertained to breast cancer. As such, getting your mammograms. So it started making me think, what about the people who don't know that they don't know? There are millions of those people, right? What about those people that don't even have a clue about, it's 1 year later, I need my mammogram? What about the people that use the emergency room as their primary care doctors? What about those people? So I started doing a little bit of research. At the same time, I was coming to the end of my treatments. So some of y'all may say, well, how are you able to do all this at the same time? I thank God at the time I was working for United Medical Center. And I couldn't have been in a better place than in a hospital around people that understood healthcare and what it was going to take. I worked for the board of directors. And so at that time, I started thinking, I finished my treatments, and my friends thought we were going to have a celebration around Natalie Williams finishing her treatments. I had it at my church, Matthews Memorial Baptist Church in Southeast Washington, D.C., and when I tell you 300 women showed up, to our surprise. They talked about it in church, of course. I think I put it on my Facebook page that I was going to have a brunch. 300 women showed up. And it was there in that moment that I knew this was an important conversation. It was also in that moment that once people learned about my experience, what I was going through, I got hundreds of emails. That's no exaggeration. Hundreds of emails from women who said, I've had breast cancer, but I never told anybody. I've had a mammogram, but it's been over 10 years since I've had my last one. Or, you look so healthy that how could you have possibly gotten it? Let me go and get tested myself. So with those three different types of messages coming my way, I said, there's something that we've got to be doing. So we had the initial celebration, and then after that, my group of friends that have since become members of my committee and board of directors and all of that, they say, we have to keep this conversation going. And so since then, we started the Natalie Williams Breast Care Foundation, not focused on cancer. You address cancer, but it's about the care. It's about the care, and it's about caring for yourself. It's about caring enough for yourself that you're going to go and get tested. It's about caring enough for your loved ones that you're going to urge them to go and get tested. And so through this foundation, I can tell you it has soared to heights that I never even initially imagined. We have touched hundreds of women across the DC metropolitan area by urging them to get tested, by hosting seminars, by doing our annual brunch that is just absolutely phenomenal. And then last year we did our first Test My Breast 5K walking wellness fair. But we set out on a mission, and this mission was we were going to have a campaign that addresses and urges women of color to be tested. And so we came up with Test My Breast. Now some of my board members who are, we can't call it Test My Breast. That's too risque. And then some of them are the ones who are more on the risky side say, that's exactly what it should be called. And so I kind of had to put an end to that internal bickering. And I said, this is why we're here. The message can't get any plainer. I want women to have their breasts tested, period. And so what we heard was, once we agreed that this would be our campaign, and once we, started putting it out there, we had folks everywhere. Natalie, I had my breast tested. I'd be down in City Hall, test your breasts. And it's one of those things that just, it rolls off your tongue. But it's such an important and powerful message that I'm just so proud that it's moving and it's spreading across the DC metropolitan area in the way that it is. Now, some hard facts about breast cancer. You would not believe that Washington, D.C., the nation's capital, where laws are made and deals are done and you name it, it's happening here. We are the number one city of all cities in the entire nation that has the highest number of new cases of breast cancer. Washington, D.C. Pick any city out there. Atlanta, Chicago, Washington, D.C. tops that list. And what's even more disturbing is that when you take a look at that list, it's women of color. So let me kind of back into that just a little bit. Our white counterparts are getting breast cancer at higher rates. Our Black and Latino women are dying at higher rates. So what does that say? That says that Caucasian women, they get there, they go early, they figure out, yes, I'm tested for breast cancer. They get getting their treatments early and start living their life again. Women of color, we wait. We don't get our mammograms as we should. And unfortunately, by the time we do get to the doctor, a large number, stage 3 and stage 4. And that makes it very difficult to treat at that point. So that's why we have such a, if I'm just talking to you bluntly, that's how we have such a significant disparity in numbers. So, people would say, well, why is that? So my friends over at MedStar did a study, Dr. Herta. He did a study in Washington, D.C., and that study took a look at breast cancer in the nation's capital. And he started the study in Ward 5. And so this study took a look at, surveyed 1,000 women, and just asked random questions about breast cancer. And what he found was astonishing. A large number of people, and I wrote it down, 97% of women had insurance, but did not go and get tested. 97. So this myth about, I don't have insurance, 97% have insurance and still don't get tested. When I heard that, I thought, that's so unfortunate for our community. And so then they talked about, well, what were the reasons why people don't go and get tested? Fear, right? So they're scared of the treatment. They're scared of what they don't know about it. They are scared of the financial burden that may come with it, right? Bankruptcy. If you don't have your stuff lined up properly, it can be expensive for you. Um, Mammogram misconceptions, that if they go and have this test, the radiation or something that's within the testing is going to give them breast cancer, right? Isn't that sad? But it's true. Personal reasons. Oh, I have no time. Oh, I've got to take care of somebody else, right? That was my excuse. No time to get to the doctor. First time I was no-show. The second time I called and canceled. The third time I got there. Remember, only because my mom was coming. Right? And so, and then the fourth reason, they have no conception around breast cancer at all. There's nobody in their family who's at risk. There's nobody in their family that's had it. So certainly, I ain't got it. So I ain't got to get tested. So those were the top four reasons that came out of the study that said, of 1,000 women that were tested with breast cancer. And so, I'm pleased that, I'm going to be working with Washington Hospital Center and MedStar to really dig deep into communities of color across the DC metropolitan area. I wanted to share with you a study that came out just today. It suggests that African American women are dying disproportionately from breast cancer by the city that they live in. It's really interesting to me because it says the study, which looked at breast cancer deaths between 2010 and 2014 in the 43 most populous U.S. city, found that African American women are 43% more likely to die from breast cancer than white women. That is an increase from 2009, when the difference in the death rates were only 39%. So what does that say to me? That says, well, let me read this other little part before I go in on them. This is a quote from the Avon Foundation. My hope is that as people look at this data and see these numbers, they understand we need to make sure we are ending breast cancer for every woman, not just some women. And I hope it's a call to action in many of these communities. So what does that say to me? That says that all the money that has been flowing for years in the Avon Foundation, in the Susan G. Komen Foundation, it's almost it's already a no-brainer to me. If your numbers suggest that it's black women and Latino women who are dying at higher rates, then it looks to me that you would change your outreach, your marketing, your conversation around breast cancer, so that if the goal is really to end or reduce the numbers, then you'd be doing something else to reach out to those women. And so, I say all the time when I go to do my speeches and all, I say, Susan G. Komen's foundation has done an extraordinary job for years. And they've really monopolized the conversation around breast cancer. They have at least made us aware and lit the country pink. But when you dig down into the numbers and actually taking a look at how we are addressing it and are we really saving lives? We're not. So I'm like, where's all that money going to? And we need to change that conversation. And so that's why, the Natalie Williams Breast Care Foundation, we have a vision. We have a vision of changing the conversation around breast cancer. And really, not to take away from the larger organizations, but to focus in on those communities that are affected the most by it. And so, we do all that we can. We have seminars, we work with, local hospitals that will refer people to us who have had their mammograms that may want to need help walking through what we call the breast cancer continuum. And, we do a lot of awareness things. I wanted to show you, which is why this is pulled up, and then I'll open the floor for any questions that you may have. They say that exercise is the one leading thing that you can do in order consistently to address your or reduce your risk, I should say, of breast cancer. And so that's why you find, a lot of organizations having walks and, using that as an outlet to raise the awareness. And so, we thought that we'd have our own walk and we would make sure that it was well publicized around the DC metropolitan area. Over 500 women registered for it. We had it in Haynes Point, and it was a cold, rainy day. So I won't say no more around that. But we were there, right? And had us a great time. And I just want to share that with you. So, as you think about, Breast Cancer Month, let's include communities of color, specifically communities of color, in the conversation, because that's where the numbers are. And if we ever really want to reduce those numbers, we got to start there. We have to start there.